Again, my name is Alan Cooper from Ancilla Partners. We are the vendor that is supporting the PerryData.net application reports. For any questions or anything that actually gets advanced of the tool itself, that's usually us that is doing so. So to kind of get started, the objective of this meeting is basically for those that either are already using PerryData and just want a refresher on some of the features of the tool itself and the reporting, or for those that have not accessed the system yet and want kind of an introduction of kind of what the tool looks like and what you can do and all that fun stuff. So hopefully by the end you feel a little bit more comfortable than you did when you started. And as always, if you ever have any questions, feel free to contact our support desk, and we're always willing to help assist anything we can. Today's training, we're going to kind of focus on the topics on this agenda. And the intent here is to kind of go through some of these areas, and I'm going to be walking through the actual tool itself with a demo user ID, so then you guys, everyone can kind of see in real life kind of how to actually navigate around. So just a quick review of some of the things that I'm hoping to cover today. Some of the reports may not happen depending on the timing, but the first thing and foremost is just kind of discuss a little bit about the web browser compatibility mode and such, and just kind of what people should be using to ensure that they don't get any unnecessary errors based on the web browser used. We'll get into kind of just the whole how to log in, how to change and reset your password, especially for those that haven't used it in a while or are new to the system. We'll talk a little bit about how the data actually gets into PerryData. We'll go over the tool itself of the overall navigation, the home page, and talk a little bit about how to find any birth records that have been entered, or in general how to create a new birth record from the beginning. And then we'll go into the actual, just a preview of just, what does the entry screens look like and some of the birth record navigation. And just briefly into help desk area, just so you know where to go if you have any questions. If time permits, we'll go a little bit into the reporting area, and this is a separate tool that is linked through PerryData called Pentaho, and that's kind of where all the kind of the reports, PDF and Excel reports are at. And then if there's any, for sure I'll make time for about five or so minutes at the end, regardless of where we're at, just open the doors up for any questions that people may have. Is there any questions now that people have that, I don't know if you guys see anything? No? Okay. So what we will do is, okay. Assuming everyone can see my screen. So this is basically the login page, and again, the address to get to the site itself for the application is www.perrydata.net. And once you get here, this is the login page. Let's see here. Okay, so so just talk a little bit about web browser compatibility. Essentially, for those that have Chrome, Google Chrome, or have Firefox, those are the preferred browsers to use with the application. And the reason for that is it doesn't have any barriers when you go between PerryData, the application, and Pentaho, the reporting system. Internet Explorer, on the other hand, has some challenges with PerryData, and when you're in PerryData, you need to be in compatibility mode, and when you're in Pentaho, the reporting, you need to be in non-compatibility mode. So you have to kind of switch between the two to kind of kind of get around that. And what I could do here is just quickly show those that don't understand what that all means. So if I log into Peri Data, and typically in the type of browser you have for Internet Explorer, there'll be an area where you can actually change your compatibility view settings. And essentially, if you want it to be in compatibility mode, you need to kind of add this as a site that you want to be part of compatibility mode. And if you don't want it to be in compatibility mode, like Pentaho, then you would want to turn that off. And a lot of this we can help you through this if you have any questions, but the point I want to make here is if you're using Internet Explorer, Peri Data, the tool itself, you should use the compatibility mode. So what we'll do is here's the login, and then if you ever forget your password, all you have to do is click on Forget Your Password link here, and then you just have to enter in either the username that you would use to typically log into the system or the email address that's associated with your user. Either one will basically send you an email that then gets you a link that you click on, and then when you click on that link, it'll actually take you to a page to actually reset your password. And once you reset your password, then you go back to the login page, and then you'll be able to log back in with that new password. One thing to note, whenever you do a reset password, you will get a link. That link actually expires after 1 day. So if you happen to get that and you don't get to that link for like over a day, you'll have to reset your password again, and then you'll get a new email with that link. Now, once you are logged in, actually, I want to make sure here. Okay, once you are logged in, you do have the ability to change your password within the tool itself. So for whatever reason that you need to change your password, you can do so. It is recommended that you attempt to change your password at least quarterly, just because of the sensitivity of the data. So it's just part of the whole healthcare quality and just security that people should just try to do. So talking a little bit about the data itself, so at least half, if not more, of the data is actually entered inside of Peri Data itself, the tool. Those that are participating in entering the data into the state, the CIVRIS system, if you ever enter in data into that system and you have an agreement with them to have the data flow into Peri Data, some of that data will actually come from that system and directly enter into Peri Data for you. And the nice thing about that is whether you start your birth record inside of Peri Data and then fill your information out in CIVRIS, the system, it will flow into our system and update anything that you have not entered into Peri Data itself. The other way around, you can always start into CIVRIS and enter the data there, let it flow into here, and then you can continue on with your record, your birth record at that point. We are attempting to wrap up the testing of a new option called the CSV import, and essentially similar to the navigations of the VR updates, we'll have 2 more links of which you can click on the CSV import and have the ability to actually get a record dump from your EHR based on the templates we'll provide and actually upload the data. And there's probably 100 or so fields, or maybe 80 to 100 fields that we're going to accept that will at least get the birth record started. Very similar concept to the CIVRIS. Is there any questions on any of this so far? Okay. So if you look at the home page when you log in, you have your left area navigation, and this kind of just allows you to kind of to go wherever you need to go based on what you need to do. And then on the right area is just kind of your home page, kind of statuses. This kind of tells you how many have been certified within the last 30 days in a year, how many have been created in the last 30 days in a year. What if you are entering in information to Cerberus, you know, how many of those have come in the last 30 days, etc., and how many of those actually need your review, meaning, you know, they came in and you need to accept them in. Some other little statuses are hospital status and state status, and the state status, you know, means that's from Cerberus, saying of the for that particular birth records, or how many are still considered incomplete as it's related to their status, and we can talk a little bit more about that. The hospital status at the moment means kind of what is necessary to be considered complete for reporting purposes for WHA. Other than that, sometimes you will get notifications like this one here, where as today we will actually have an hour downtime because we have some new items into the Perry data system that we want to bring to life to production. So these type of notifications will be up like here, and they typically are only up there for like a day or two just to give notice, whether it's a downtime, planned or unplanned. Anything that requires the attention of the user will typically be up here. We also have other news out there that typically we will also put down any downtimes or whatever down here, or any other special types of updates or news historically that those that need to know will know. So, you know, the next thing is to talk a little bit about the navigations themselves here. So we have a few areas. So we have the birth records and the completions and the certificate. Essentially, every single one of these links here, from certification, completion, and birth records, is really just a different way of actually viewing your birth records in terms of where they are at in the stage of their completeness. So if I kind of go down here, you have your closed records, and essentially closed records, some people that we've noticed when we work on the support side are not very clear what that really means. And what that really means is that the record, the birth record itself, has been completed, and you as someone in the hospital has chosen to consider it closed. And that just means that there's not much more you can enter into that record anymore. So it ends up kind of getting out of some of these other views, mainly because there's not much more you need to do with it. But if you ever have to reference it again, you can always go back to the closed records, and you'll see that birth record for historical sakes. Some of these other ones, fetal deaths, recent births, these are just statuses that if you want to see the records that are considered fetal deaths, or if you want to look at what the recent births are, that these are ways, again, that you can click on to actually see what records are out there that are considered recent births. So this is a recent births one. So there's a status out there that says where the infant was born in the last 2 months, they would be considered as a filter of recent births. Now you have the VR update and the VR update needs review. The VR updates is that are records that have been received from the VR updates, so from Cerberus. And the review is records that need to be reviewed by someone in the hospital. So there's something, you know, they need to review it and accept it into the actual Perry data. Now the last one here is probably the more common one that people may go to, is just to click on the search itself. And basically this allows the user to actually enter in any piece of information about the birth record that they may have to find whether that birth record is there. And the most common one is typically, you know, either the mother's medical record or the infant's medical record. And that's typically the first thing anyone should do if they ever are tasked to actually enter in a new birth record. In the event that someone else may have entered it in already, or perhaps, you know, someone has entered into a different mechanism like the Cerberus system that may have entered into the system, you want to attempt to avoid duplicating a birth record by making sure that it's not there. Now, when you enter it in, it's not there. It'll probably come back blank that if you put in something there that's not there. And in that case, then you can go and click up here. There's a link called Create New Birth Record. And that gives you ability to actually start a new birth record. And at that point, you can fill in the information that you have at hand to complete the record itself. There's some other statuses, so that's kind of the birth records navigation area. And again, similar to the above, you have the completion ones, and this just kind of helps you understand based on the area of focus. So the hospital complete record or incomplete records. This just indicates that the birth records that are complete in the eyes of what we sent reports for to WHA lets you know that these particular birth records are all complete, and then these would be a part of any reports we ever send over there. So that means that if you didn't fill anything else out, at least from a WHA or hospital status perspective, it's complete. You will notice an example here that we have some of the state one. There's another status for the state, and that's for Sybaris, that some of these records are considered incomplete. So the nice thing about this is that it allows you to see what's complete for this particular view, but it also then lets you know from a data perspective that, oh, these are still considered incomplete from a state perspective. So these are just different ways of slicing and dicing up the filters to allow you to kind of see basically your birth records depending on what you're looking for. And then the last one again is a certification or certified records, and we have one in our test bed here that's considered certified. And you'll notice that if I go back to this hospital complete status, you'll notice that from a state perspective they're certified, and from a hospital perspective they're complete. Once they're certified and the record's complete, you do have the ability to close that record. And what that means is that the data that for this particular birth record is complete enough that you can close it, and it won't be part of something of the other filters anymore. So then you can kind of basically work your information and focus on the ones that need your attention versus have these other that are considered complete kind of prevents you from doing so. So what I thought we can do next is actually go into, well, I guess this is actually a pretty good view here to look at. The other thing, depending on the view you're looking at from a filtering perspective, you'll notice some actions you can do to a particular birth record. So you have the dashboard view, you have an edit, you have a remove, and you have a view. And the dashboard view basically gives you the ability to kind of look at a summary level of this particular birth record, and it gives you kind of statistics of change, their statuses in general, and who did what in terms of actually changing the records, and then from this point you can also create, do more actions. So edit and view basically look at the same exact screen. I'll show you in a moment. It's just edit allows you to edit the record itself. Now, some of this is based on the fact that Peridata itself has a security model that you may have the ability to view and not have edit ability, and that would be something that would prevent you from editing, and that link itself would be removed. You also have the remove here, though. The remove is something that if you click that, it's intentional, and you can consider it a deletion of the record from the system. Now, it isn't permanently gone. It's just deleted in a sense that you may, for the most part, you probably are doing this because it's a duplicate record or it's a record that is not valid. And again, you should only do this for those two reasons, and otherwise you should probably not do that, or at least call us in support to ask questions of why you should or should not do that. And then you have the worksheet, and this is kind of the certificate that you would send for related to the Department of Health Services. So if I go here and click on Edit, you'll notice I'm going into an existing record that's already been started. You'll notice that the header information of a particular birth is up above, and you'll also notice there's a bunch of statuses here, or I shouldn't say statuses, but they are statuses, but you have the green that represents state complete, and the blue represents hospital complete. And as I stated above, all of these that are marked as blue or green represents whether the fields that are necessary within each of those areas is considered complete or not. You'll notice that the empty ones here, this one is saying that the state one is incomplete. There's something about the mother's address that is not yet filled in yet. And what I can do is actually navigate to that to show you. There are typically symbols that are there to represent that. But in general, I'm not going to go through how to enter this information in general, but most of this information everyone should have at hand in some shape or form to complete an actual birth record. And there are typically tips that are available that if you mouse over and click on a field, it'll help you explain what it is that you're supposed to fill out if it's something that you're unaware of. Now going to the birth or for the address here, you'll notice that the street name and number for this particular residence is not filled in. And again, this would be required for the state. So once you actually fill in this address, this would change its status incomplete to complete. So you'll notice that once that happened, this stopped being bolded and highlighted, and also removed the bullet point that represented it being incomplete. You'll also notice that once I hit Save and Next, that the green up above there should change, unless there was something else here. It must have been something else about the address too. Oh yeah, up above here. It's okay. And then I think I'll hit Save. There's something else here. Yeah, you'll notice now it's green. So switch from incomplete to complete. And essentially, that's kind of how you work through each of the areas to help complete the information that is necessary for mainly for reporting purposes, depending on what reports are being sent where. Now, if you ever started a new record, as I stated before, go back to home here, and if you do a search based on medical record or name, and you're unable to find anything, you can just click on Create a New Birth Record, and then that'll basically start a new birth record for you, and then you just start completing the information, starting from the top to the bottom. There are other navigation, like if you can just click on Next each time to kind of move through each of these areas as you complete them. So for instance, I can just click on Next here, and it'll take me to the mother's information. And you'll notice again that some, what they considered required fields to have a complete status. And once you fill information, those will be kind of removed. And there are ability for you to jump between areas if for whatever reason you don't have all the information to hit next. You can actually, if you have like some information here and some information down here, and you don't have some of the history as an example right away, you can just jump to some of these areas and not have to hit next the whole time. And then I'll go back to home here. Oh, the other thing to mention, I guess I'll go back to a record here is there are some cases where if you fill out the wrong information, some fields will have a pop-up indicating that you have not filled in something correctly, or are you sure type of questions, just to help improve the accuracy of the data itself. Trying to think if I can figure out, I think trying to find an area here where I can kind of have that pop up here. Well, I'll try to think of one. The other thing I wanted to also mention is a lot of areas that have a lot of information that in general are either considered no or considered unknown. We do have features that if you click on default to no or default to unknown, then you click these buttons and it'll actually pre-populate the areas within this subsection. This is kind of handy for some areas that are more abnormal than not of actually having something filled in. Now the help desk area, there's a few items here. As I mentioned before, you have the change password if you have to change that. You can also edit your own information here. In the event that you have to request that someone on your staff needs to be added to Perry Data as a user, you can go to click on the security user contact information, and this lists out all security people related to each hospital, and in your case, your particular hospital. So then you can talk to them about adding a new user. If you are challenged in trying to find that person, or for whatever reason that person no longer works at the hospital, definitely feel free to call us at the support desk to help you through that, so we can reassign a new security person that then can help you in the future for new users. We also have the data dictionary area, and what this kind of does is that this kind of details out every single record and describes what information that needs to be filled out if for whatever reason you just wanted to look at it holistically. It also kind of tells you what types of reports are available and describes, again, in detail what is made up of those reports, how is it calculated, etc. And then the final area is the help desk. And you can click on the help, and this will basically take you to an application called Zendesk. But essentially, this is where you can actually enter in a ticket if you ever need help, whether it's just a question or you found a bug that in the system itself that's preventing you from actually completing your records. Whatever the case may be, you just click on that help, and then it will take you to a new area where you can actually enter in information. You can also leverage these as well as mechanisms, whether it's actually calling us directly or send an email as well. The email actually will track basically whatever you enter in your email into the actual help desk, so we can actually respond to you in a timely manner and help you resolve your issue. So we have about 10 more minutes. I'm just debating on whether we open it up now, see if we have any questions, and I can maybe pop into the reports area just so people can see how to get to it and see kind of how to get to the data, the reports itself. Do we have any questions offhand that people want me to answer? I don't know, Barb or Lisa, do you see anything?
Alan, I don't see any questions at all.
Okay. Well, what I can do is since we have 10 minutes or less, let me jump in to the reports area. So to get to, if your user has the ability to see reports, you will notice that the standard reports area will be available to you. So you can just click on the standard reports server, and what's going to happen is it's going to pop up a new screen called Pentaho. And then what you do is you use the same username and password that you've used to in PeriData, and you just click on Login. And then you will be directed to the landing page. Now from here, you have two ways of actually getting to the reports. One way is through File and Open, or you can just click right from here and just Browse Files. If you click on Browse Files, you go to Public, and then you'll notice you have your standard reports here. So you click on standard reports. And if you click on the arrows, the arrows basically allow you to see what other directories or folders are available for you. And if you don't see an arrow, then you can actually click on the actual name itself to actually see what files or reports are available to you. So we kind of have two areas where we see the reports. If we have the standard reports where it's just simply these summary reports and their PDF reports that allow you to see information in typically more of an aggregation summary form. And then some other standard reports like the checkpoint review, which some of people have used, or like delivery summary, where they have special types of filters, have kind of a subfolder so you can dive into to see some of those. We've had a few support tickets trying to understand what's considered summary, and and how can I actually see patient level information. All the PDF reports or standard reports in this field, except for the delivery log report, are considered summary level reports. You do have the delivery log report that is more of a formatted PDF that allows you to select a date range and actually then be able to look at your birth records in a PDF form. So I'll just, as an example, you can go and click on delivery log report here, and actually what I'll do is just demographic summary, and then you have a few ways of actually opening up the report. You can open up in a new window, or you can just open it up and it'll just create a new tab. Either one will get you the report. So I'll just click on open here. And then typically most reports always have kind of a date range. And some reports have the ability to filter on attendance. Some reports have the ability to filter on if you're more than one facility. You can select one facility. Some reports allow you to select multiple facility. And then you have your date range. So if just to use it as an example, I'll just do 1 year for this hospital, and I'll just show all attendance then. And all you do is click on View Reports, and you'll notice on the bottom here that the report here is accessible for you to see. And then you are able to, for the PDF, able to save this if you need to kind of distribute that within the hospital or use it for whatever purpose you may have. If you want to kind of see a full screen of this, there's this little toggle thing called Report Parameters that right now you'll notice that it's indented, and that means that it's viewable. If you click it again to kind of hide it, you can see the report in a broader way. The other thing I want to make note here is that when you do select filters here, make note that the screen sometimes may flash, and what it's doing is it's sometimes refreshing the screen on the filters, but it's not really running the report yet. So as an example, if I click on that, you'll notice that it's refreshing the actual filter screen. But you have to click on View Report to actually see the report. And if you want to go back, to the other things, you can just click on Browse Files, and they'll take you back to where you were. Just to quickly show you the delivery log report, the details. So this one is considered, at the birth record. Actually, this one will be at the delivery record, not the birth record. And just to give an example what that one looks like. And this will list out, the actual deliveries, and it will kind of show you if you had more than one child or not, and some key information that we believe are useful for the hospitals to see. If you don't want to see that report anymore, you just click on the X there, and it'll close it up, and then you can go on to the next reports. So I think we have 4 more minutes. Is there any other questions here? Because otherwise I was going to quickly just show you where you can look at Excel reports. And that's, I won't go in details of some of those reports. That's a little more advanced in nature, but at least want to show you what they look like. So I don't think there's any questions. So,
Alan, it does look like there's a question from a viewer. With Pentaho, does it matter what browser is used?
No, any browser works. If you use Internet Explorer, do not have an compatibility mode. If you have a compatibility mode, it won't show very well.
Okay.
Okay. Well, real quick here, so I have 3 more minutes here. So an example of a report that's used by the group is the checkpoint review. And this is kind of displayed in 2 fashions. One fashion is you have 1 through 8 here that represent, in the old system, 8 tabs of data. And you can also see that exact same report in the checkpoint review for all tabs. There is currently a constraint in Pentaho that we're hoping to fix this year, that as the tabs are actually displayed, it pushes down records. So we recommend that you kind of use the 1 through 8 here to see your information. So if you just click on that, and again, just click on Open. Very similar to PDF. Basically, what it's going to do is ask you for a date range and facility. And then you can just click on the View Report. And what's going to happen is, depending on the browser, for Chrome, you'll notice down below that it has saved off a CSV or Excel spreadsheet. With Firefox, anything you download will typically show up in a little download area up above. And then I believe Internet Explorer actually does a pop-up box and asking you whether you want to save it or open it right away. So each browser kind of handles it a little bit differently. So I just click on that to open up the actual report, and I'll move it over here. So this is an Excel spreadsheet, and obviously this one is the first summary, so it doesn't give you a lot of information. But for the other reports, it'll give you more information that is more useful for you to do what you need to do. So I think that concludes our session. If there's any other questions, we have a little over a minute. I can answer anything. If you have any questions that's outside of the actual webinar itself, feel free to call our support or email our support, and we can answer it right away. And if anyone needs a little bit more assistance, we definitely could do a one-on-one walkthrough as well. So hopefully this gives everyone a little bit of a starting point if you needed it, or a minimum refresher on some of the Peri data capability as well as the Pentaho reporting. And again, if you have any other questions, feel free to call support or email support. And it is our intent that we will have these basic sessions at least once every quarter because we do understand a lot of hospitals have new people that join and that have to use the system. And if you do need a training session, a one-on-one that is something more immediate than not, feel free to schedule that with us and we can work with you. Thank you for everyone's time and enjoy the rest of your day.